Hi, so I wanted to talk about diabetes today and how weight loss surgery may be able to either help resolve diabetes if you already have it or if you have prediabetes, or help you potentially to, not get diabetes, right? To prevent it completely. So first off, I always kind of like to explain what diabetes is. It's a really complex disease. A lot of you might know there's different types. So there's, type 1, which is usually juvenile onset, and that's when the pancreas doesn't produce insulin at all. And then there's type 2, which is more common, especially for people that are older and overweight or obese. That can be kind of a common cause. So what happens with diabetes is either one, like I said, the pancreas is not producing enough insulin or potentially not producing insulin at all. The insulin that is being produced may not be working the way that it really should in the body. And the other thing that can happen is the cells of the body can actually become resistant to insulin. And so I think it's good to know too sort of what the role of insulin is. So when you eat a meal that has, carbohydrates and fats and proteins in it, your body starts to break it down. And especially those carbohydrates, it breaks down into more simple starches and sugars. And what happens is when your body notices those sugar molecules coming down, your pancreas is supposed to release insulin. And what insulin does is it essentially opens the door to the cell so that sugar, that carbohydrate, can get from the bloodstream into the cells so your cells can use it for energy, right? Carbohydrates are the body's main source of energy and the preferred source of energy. They're sort of the most efficient form, if you want to think of it that way. And so what can happen is if your insulin's not working as it should, or you're not making enough, or again, the cells are resistant, is you have this buildup of blood sugar or this buildup of blood glucose in the bloodstream. And what happens then is this buildup is what can eventually lead to diabetes. So I always kind of like to explain it as if you think about if you broke a wine glass, right? And there are all these, pieces of glass all over the floor, and maybe you sweep up the big pieces of glass and you think you get most of the little ones, and then a few minutes later maybe you noticed just this tiniest speck or shard of glass on the ground, and you use your finger and kind of pick it up, right? And maybe you just get the smallest little cut in the tip of your finger, right? And you can kind of flick it away and throw the shard away and you're fine. Maybe you have a little bit of a sore there, but it's probably gone by, the evening or even the next day. However, if you were to have to pick up a small shard of glass 5 or 10 times a day, gradually your finger is going to get pretty worn down, right? You're going to have a pretty good wound. You're probably going to need a Band-Aid. And then if you continue to do that day after day after day, you're going to have a really serious wound on your hand in no time at all. And so if you can think about a shard of glass under a microscope and a sugar crystal under a microscope, they essentially look very similar. And so those sugar crystals, if you will, sort of act like shards of glass when there's too much in your bloodstream. Our blood always likes to have a nice sort of even amount of glucose in it, right? If we go too low, we get hypoglycemic or have low blood sugar, and we might feel nauseous, weak, lightheaded, dizzy, kind of clammy. Some people get really angry and irritated. I know I do. But if it's too high, we don't really notice those symptoms as much, which can be a problem because a lot of people will have high blood glucose or high blood sugar or be pre-diabetic and not know it, right? But what happens is when those little sugar crystals build up in the bloodstream, they damage those blood vessel walls because it's like little shards of glass gradually kind of eating and cutting away at that blood vessel. And so that in turn affects our vital organs, like our heart, our kidneys specifically. You don't see as well. You might develop neuropathy, have trouble healing in your extremities, your hands, especially your feet. So that is why this high blood sugar, this high blood glucose, prediabetes and diabetes are such an issue, right? So with weight loss surgery, there's really some exciting research that shows the metabolic effects of having a weight loss surgery. And this is even before a lot of patients have seen significant weight loss. So we know from research that patients that have maybe a biliopancreatic diversion, a gastric bypass Roux-en-Y, or a sleeve gastrectomy can have improvements in their blood glucose and their diabetes management within 24 to 48 hours of surgery. And this isn't completely understood. We're finding out kind of more of why this is happening, but it's just one benefit of weight loss surgery. Now, a biliopancreatic diversion, with or without the duodenal switch, has been shown to have the biggest benefit on diabetes management, either resolving diabetes or potentially preventing it. However, because of the increased risk of complications, a lot of micronutrient deficiency issues, that's usually not a procedure that's recommended by most surgeons. The gastric bypass Roux-en-Y has sort of been the next best for helping to resolve diabetes or prevent it, followed by the gastric sleeve. And so it really depends on, your medical history, how old you are, how much weight you would like to lose, or how much weight is recommended that you lose by your physician. So this is always a good conversation to have with your, primary doctor and with your potential bariatric surgeon to kind of figure out which surgery will really help, maximize your potential to either, again, resolve diabetes or potentially even prevent it. So I hope that helps explain a little bit. It is a very complicated disease. It's hard to kind of make into a short video, but if you have any questions or concerns, I'm always happy to answer them in the comment section below. Thanks.